are listening to the Alzheimer's Podcast with Mike Good of Togetherness, your number one resource for practical tips and insights, empowering you and your family to live well with Alzheimer's. Hello and welcome to episode number 3. This is Mike Good of Togetherness. Thank you for joining me for another episode of the Alzheimer's Podcast. My goal is to empower you to maintain a positive experience, reduce and eliminate the need for medications, and make your time together with those you care for the best it can be. Before we start, please understand I am not a medical professional, and you should always consult with the appropriate medical professional. Coming up in this episode, I'll be discussing the medications specifically used to help our loved ones who have Alzheimer's or another type of dementia, the professionals who you must consult with, and strategies you can implement to help manage and ideally reduce medication usage. Managing medications is at the top of the caregiving responsibilities list. Without proper attention, the consequences can be hazardous to your loved one's health. It's a daunting task that includes appointments, filling prescriptions, adherence to medication schedules, observing outcomes, logging pertinent data, investigative research, and communicating with all care partners. With older adults taking around 5 prescriptions per day, bad medication interactions and side effects have the potential to negatively affect both the safety and well-being of your loved one. Side effects can range from mood swings to death in extreme cases. Even a young, vibrant individual would struggle to adhere to 5 prescriptions along with any other medications. Now combine this with memory impairment and other age-related issues, and you should be able to see the importance of this responsibility. There can be a lot to track, and that's why I'm providing you with the proper form to help you stay on top of things. It's called a medicine record and was created by the FDA. Visit the show notes at togetherness.com/episode 3 to get a copy of this free form. Be sure to complete the medicine record for your loved one and yourself while you're at it. It's a simple form that will help you and other care partners, including professionals and family, understand the medications your loved one is currently taking. Be sure to include all medications your loved one takes. When managing the medications for someone or yourself, as far as that goes, you should be tracking medicines that require a prescription, over-the-counter medicines, dietary supplements such as vitamins, herbal supplements, nutrition shakes. It's also important to be aware of alcohol, caffeine, nicotine, or any other illicit drug use, as these can have adverse effects when combined with other medications. Medications also come in various forms, including pill, injection, liquid, or cream. As you populate the medicine record, begin reading and taking notes about the different medications. Research these drugs and get educated about what your loved one is taking. In the show notes, I'll also include a 19-page booklet by the U.S. Department of Health and Human Services that gives a more in-depth discussion on medication management. Next, I want to quickly cover a couple of the medical professionals who are important to better medication management. Let me start with a quick story. I had a friend and support group who would report to us that his wife was declining faster these days. She could no longer help with dinner, and she was unable to get out of the house and go on little excursions like they had been doing. He would also share how they hadn't been to the doctor in a while because of issues with their insurance. Then one day, he shared something that was shocking. His wife had helped him make dinner the night before, and they were planning to go to their grandson's soccer game. A complete turnaround. What? I remember thinking. He was finally able to take his wife to their geriatric psychiatrist, who made a change to her pain medication for her back. Turns out his wife wasn't declining from the disease, she was declining due to a bad medication. Wow. While it may be your primary doctor who makes prescriptions, It's really the psychiatrist who will review the medications and make adjustments. A geriatric psychiatrist specializes in the diagnosis and treatment of behavioral and cognitive issues in older adults, including dementia. They also prescribe and help manage medications. Your pharmacist is also trained in this area. Pharmacists are the medication experts who advise other medical professionals, patients, and caregivers on the selection, dosage, and side effects of medications. So please make sure you complete the medication form and have it reviewed by these experts. Next, I'll discuss the medications which are approved to help treat Alzheimer's disease. All our lives we have put our trust in the medical professionals to examine us and send us on our way with a prescription that fixes everything. But for Alzheimer's and other related dementias, there are no miracle prescriptions. In fact, medications that cure or alter the course of Alzheimer's disease don't exist, and whether they lessen the symptoms is a debatable topic. According to Consumer Reports, the medications used to treat mental decline in people with Alzheimer's disease are not particularly effective. When compared to a placebo, most people who take one will not experience a meaningful benefit, and it is the rare person who has a significant delay in the worsening of their symptoms over time. Consumer Reports, you might be asking? Yes, Consumer Reports. Who better to provide unbiased information, at least in my opinion? Now, I must caveat this by saying I have heard many caregivers say they have seen positive effects. On the flip side, I have also listened to 2 neurologists say they have chosen not to use these medications for their loved one who has Alzheimer's. It's simply a cruddy situation. I call it the catch-22 of Alzheimer's medications because you really have no choice but to buy expensive drugs for your loved one, just hoping that by some luck your loved one will be one of the rare persons that experiences a positive effect. Let's be honest, you probably won't be able to sleep at night if you don't have them on some kind of medication. After all, that's the approach that's been ingrained in our heads since we were young. Take a pill and make it all better. And if a doctor doesn't prescribe something, we think they're not doing their job. So what's the purpose of Alzheimer medications? As you should know by now, these drugs don't cure Alzheimer's. They are merely intended to slow the progression and ease the symptoms. But more than anything, in my opinion, they give the caregiver the peace of mind they are doing the best for their loved one they can. As mentioned, it's all debatable whether they work or not. Some argue there's only a placebo effect and it's the only value. Many argue they have seen benefits, however. It's up to you to make this decision. There are basically 5 medications prescribed for Alzheimer's disease. 3 of these 5 are in the same classification and work the same. The brand name for these 3 are Aricept, Razidine, and Exelon. These 3 are prescribed for early to moderate stages. For moderate to late stage Alzheimer's disease, there are currently 2 drugs. The first is Namenda, and for years this was the only one available. But starting in early 2015, Namzaric was approved. This is a combination of the pre-mentioned Namenda and the pre-mentioned Aricept. You may have noticed that all of the drugs cover the moderate stage, so it's not unheard of for someone to be on multiple medications. Now, which Alzheimer's medications should you use? Again, I'm not a doctor, so you must consult with your loved one's doctor. Consumer Reports advice is, buy the one that's the cheapest and has the fewest side effects. You may have to try different drugs to find the one that has the least side effects for your loved one. These side effects may include diarrhea, vomiting, nausea, dizziness, confusion, headaches, constipation, fatigue, insomnia, nightmares, loss of appetite, and weight loss. By the way, I know a caregiver who accidentally took one of her husband's pills and she had nightmares that night. So please be observant, and I always recommend keeping a notebook handy to log your observations. Remember, do no harm. If these drugs cause side effects, you really must ask if it's worth it. And how will you know they are working? You may not, and if you do, it may be for a short period of time. I hear caregivers sometimes say they saw a short initial improvement, and I wonder if this is possibly simply a placebo effect. Some caregivers say the improvements are noticeable and last. However, after your loved one has been on the medication for a while, there will be a point where you start wondering if the drugs are working. But how will you know? You won't. You can't take them off the drug. That just wouldn't be fair to them. Or would it? I do know caregivers that have made the decision to take their loved ones off these medications. So don't be afraid if you have to make the same decision. Check out the show notes for the full report and more comprehensive discussion of these medications from Consumer Reports. Those are the medications approved by the United States Food and Drug Administration to delay the symptoms of Alzheimer's. Let's now talk about the medications which are not approved but are often used to treat behaviors related to Alzheimer's. You see, doctors and other medical professionals are allowed to issue prescriptions for what is referred to as off-label use. When a drug is prescribed for a disease it wasn't approved to treat, it's considered off-label. Although proven to be largely ineffective, these medications are still prescribed for the behavioral and psychological symptoms of Alzheimer's and other dementia. In dementia care, off-label medications often include antipsychotics, antidepressants, anti-anxiety, and other mood stabilizers, all of which change brain function and result in alterations in perception, mood, and consciousness. Antipsychotics are the most common medications used to address difficult behaviors and symptoms. These medications are a class of psychiatric drug primarily used to manage psychosis, which is characterized by disconnection from reality, in particular schizophrenia and bipolar disorder. When off-label medications are prescribed for people with dementia, it's generally for agitation, aggression, anxiety, sleeplessness, depression, hallucinations, and delusions. This is because these medications have a calming and sedative effect. Unfortunately, this decreases the individual's quality of life as they are no longer able to fully engage in activities or with other people. The list of potential side effects is extensive, and in 2005 the FDA issued a black box warning citing an increased risk of death 1.6 to 1.7 times greater than those taking a placebo. There is a lot written about the abundance of inappropriate antipsychotic prescriptions in dementia care, and some studies suggest that more than 2/3 of all antipsychotic prescriptions are inappropriate. Some say it's higher. Your goal should always be to use these drugs as a last resort for minimal duration and only after other non-drug interventions are tried. Although minimizing the use of these medications is an essential part of living well with the disease, it's definitely not easy. So let's discuss some strategies to help you accomplish this. Please understand that discussions on these strategies could be day-long podcasts on their own, so this will be an overview. Since most undesirable behaviors, which are often medicated for, are triggered by the environment, it's most effective to focus on improving the environment before resorting to medication. Our behavior is typically a result of our environment. This includes the physical aspects as well as the behavior of people around us. That includes you, the caregiver. For people with dementia, whether it's Alzheimer's disease or another type of cognitive impairment, it's no different. However, the way their brains process sensory input is not within their control. This often leads to a double standard when people with dementia exhibit behaviors that are deemed inappropriate. The same actions when exhibited by someone without dementia might be frowned upon, but are often accepted. I'm going to repeat that. There is often a double standard when people with dementia exhibit behaviors that are deemed inappropriate. The same actions when exhibited by someone without dementia might be frowned upon, but are often accepted. Remember, people with dementia have the same rights as everyone else, and you must be empathetic to their needs. There is almost always a reason, or trigger as I refer to it, behind an action. A trigger is something such as an action, event, or stimuli that initiates or precipitates a reaction or series of reactions. This results in either a positive or negative outcome. The negative triggers result in difficult and undesirable behaviors such as confusion, frustration, overwhelm, anger, exiting the home, and even depression. The goal is to learn how to identify the trigger or triggers that are negatively affecting your loved one's behavior. Instead of looking at the behavior as bad, look for the context or how the environment is out of sync for your loved one and explore what can be changed to make it better. I don't have time to go into all the different behaviors which may be triggered, but I'll give you a quick example that is very common. Because family caregivers are under a great amount of stress and generally don't have the training needed to cope with this situation, they often implement an all-or-nothing approach to care. You can't do that. You can't go there. You have to stop. If you infringe on your loved one's will to do something, or you treat them in a condescending manner, you will likely trigger a negative response. This situation may even escalate as they fight to defend their independence. It's all too common for the individual to become combative and then labeled as aggressive and dangerous. The next step, unfortunately, is often a sedative. But imagine for a moment if someone was prohibiting you from doing something you want to do. How would you respond? However, if the undesirable and sometimes aggressive behavior can be avoided in the first place, everyone will have a more pleasant interaction, medications can be minimized, and the well-being of the individual and their family can be maximized. Again, I say family because a negative environment is not healthy for anyone. Let's talk about a more proactive and healthier approach. Whether you're helping a family care for a loved one at home or you're helping residents in a care home, becoming a dementia detective is a skill worth developing. Start by observing the individual's surroundings. Pay attention to noises, sounds, air temperature, people, and the demeanor of those around them. This includes the caregivers. Note anything that may be affecting the person. Behaviors often repeat in dementia care, so keep a log of what you've observed. Note things such as time of day, what they were doing, who they were with, what they ingested, food, medication, liquid, etc. Compare your notes and look for patterns. Discuss the information with other care partners if possible. If you're a professional caregiver, it's also very helpful to review the individual's profile to help you better understand their likes and dislikes. This, coupled with their life history and experiences, will often help provide clues. Triggers can result in behaviors we would rather avoid, such as anger and aggression or exiting the home and becoming lost. Sometimes there are safety concerns, such as when the individual wants to leave because they just saw a bus pull up or they don't feel at home. Another example is when someone constantly wants to use the bathroom. I know of one family that, due to incontinence issues, placed a portable commode in eyesight so their loved one could quickly find it and hopefully avoid embarrassing accidents. However, this triggered her to constantly want to use the commode because she was always seeing it. The simple fix was to move the commode a few feet away where it was no longer within her line of sight. Some triggers, such as this example, are easily remedied, while others take considerable observation, analysis, and creativity. Remember that all situations take considerable empathy. Always respect the individual as you would want to be treated. This will allow your heart to stay open as you work hard to help them. Taking the time to understand how the environment is affecting the person with dementia is essential to creating a dementia-friendly home where triggers have been minimized and medications avoided. When you do, you will see fewer undesirable behaviors, everyone's well-being will benefit, and you will avoid a potential crisis. That concludes today's episode where I discuss the importance of your role in medication management, the professionals who you should have review all of the medications, the medications used in dementia care, both approved and the off-label, and strategies you can use to minimize the use of these off-label medications. Thank you very much for joining me today, and be sure to head over to the show notes to get the medications form and all reference resources at togetherinthis.com/episode 3. I can't wait to talk with you in episode 4, where I'll discuss how reframing your view of the disease is a critical step to improving the care you provide for your loved one. It's a glass half full approach to care. Bye now. You've been listening to the Alzheimer's Podcast with Mike Good of Togetherness. For more information and to get the resources mentioned in this episode, visit togetherinthis.com/podcast.